Hello, hi. My name is Mr. Abdulhadi Ismail. I'm one of the cardiac surgery registrars at University Hospital Southampton NHS Foundation Trust. If you are applying for your first job in the UK, you must have an understanding of the job titles and what do they actually mean in terms of duties and responsibilities. When you search on NHS jobs, you will discover that the same job may be advertised under various titles. To simplify it, all jobs fall in one of 5 categories or ranks or grades, if you'd like to call it. First grade is the house officer, or also called foundation doctor, sometimes even called foundation year 1 or 2. This job mainly entails clerking patients, preparing discharge summaries, requesting tests, and minor tasks such as inserting cannulas, drawing bloods, and so on. The salary usually ranges between 2,000 and 3,000 Great Britain pounds, because they don't do nights and sometimes they don't even do weekends. Every month they rotate into a different specialty. The next grade is a senior house officer, sometimes referred to as junior clinical fellow, SHO, clinical fellow, or even CT1 or 2 equivalent or ST1 or 2 equivalent. His duties includes the same as the house officer, plus more clinical duties such as going to the theatre with his consultants and registrars, attending clinics, seeing patients with his registrars. This job is usually in one specialty, although recently a lot of trusts has introduced the core medical or the core surgical fellowships. These rotate between medical or surgical specialties only. The switch happens every 9 months. The salary usually ranges between 2,500 to 3,000 pounds. The next grade is an SPR, also known as the Senior Clinical Fellow, ST3 equivalent, or even a clinical fellow. His duty is closely related to his consultant. They go together to theatres, clinics, MDTs. He reviews patients on behalf of his consultants and takes decisions after consulting with him. He oversees the SHOs and the house officers. To be eligible for this grade, you must have MRCS, first stage of the MRCP, or equivalent degrees. His salary is 3,000 to 4,000 pounds. Next grade is the consultant. You must have FRCS or finished your MRCP, and you must also have a good CV fully stacked with practical, academic, and research experience. You should also have good references from senior consultants. You then apply for the specialist registration, and your first job will be locum job for a year or so. Then you become substantive consultant. The salary ranges between 6,000 to 10,000 per month. Besides, it's the only grade which is allowed to work in the private sector and provide service in return for money for patients. As a matter of fact, there is one more grade, somewhere between the SPR and consultant grades. This is referred to as the specialty doctor grade, which is only available in few places. This is a rather unique grade in which you get paid as a registrar and work as a consultant, or the opposite, vice versa. This job also has a variable titles such as specialty doctor, fellowship of X, Y, or Z, senior surgical fellow, and so on. The job is made for senior doctors who finished their training and still looking for consultant jobs. I hope I managed to summarize this topic. Please subscribe to our YouTube channel to get regular updates of the future topics, and thank you.